Okay, so Medicare rebate, parents will probably ask you about this because it's pretty well known that speech pathology, you can get rebated through Medicare. So you obviously need to have a Medicare card. About 95% of the families will have a Medicare card, so they're eligible for that service. Not every single GP will fill out one of these forms, so they have to go there first. So we can't do anything until we have the EPC or the CDM. They're both exactly the same thing. So basically it's for 5 sessions per calendar year per child. And each of those sessions is about $55 that gets rebated. So the family still pays the same amount, and we give them a special receipt that they take to Medicare or they claim it on their app. So it's the only time they won't get a receipt from our booking system. We can't give 2 receipts because some families will claim 1 receipt on private and they'll claim another one on Medicare, which is fraud. And if we get audited by Medicare or the private health fund, you guys will be the ones in trouble because we can't issue 2 receipts. So that's the only time we will give them like a paper receipt for Medicare. They have been getting my receipt template for like 14 years and it goes through without a trick. So that's fine. The item code is like 10970. It's already on the receipt. There's only really one item code that is used for speech therapy. And like every couple of years, the rebate will kind of increase. But at the moment, it's like $55.10 or something like that. And it can be rebated for literally any session. So it could be for 1 assessment, 1 therapy. The session just needs to be longer than 20 minutes, which all of our sessions are. So we meet the criteria. So at the beginning of a session, I always say to parents, do you have any letters or referrals or anything you'd like me to read? 9 times out of 10, they'll go, yes, I've got a form from my doctor. If they don't, it's a great idea to bring up with them, have you heard about the Medicare rebate, or have you spoken to your GP about Medicare rebate? And then just explain to them that their child may be eligible for 5 rebated sessions. And as part of accessing the EPC, they need to have another allied health professional involved in the management of a child. So obviously an audiologist. So I always say to parents, yeah, just mention that you're going to see an audiologist or maybe even a pediatrician, because they may want to know another person that you're working with. So I've had maybe a few parents that say their GP absolutely just wouldn't fill out that form, which is super unusual. And then they'll go to just a GP they've never met before and they'll fill it out straight away. So that's just something random. We actually need to physically have that piece of paper or be able to take a photo of it to upload into our system, because it is a legal requirement as part of accessing that Medicare rebate. So just be aware, don't ever write a receipt without seeing it first, even if they say it's at home or anything like that, because they can go back and claim $55. And I have heard it happen to a lady I used to work with many moons ago, who was she was fined for $30,000 because of Medicare fraud. And it was just a matter of not keeping the right documentation and adhering to the rules of Medicare, which are really basic. So the other thing is we need to write an initial letter to a GP. By letter, it is a template that we use and you fill out and sign, and a final letter. So at the end of the 5 sessions, or if they only do like 2 sessions, just at the end of that. So you just, again, a template, a nice little template, write down a few goals, sign it. And I always say the report is with the family, please request a copy. I'm really big on just the family providing what they need to people. You know, we've got enough on our plates. So yeah, so that's important to know, and the parent will consent to that. They've already done that in the intake form. So if they are using the EPC form, they have to consent that we liaise with the doctor. It's part of it. And we do that in the session. So when they bring that file, that letter, I'll say, great, I just have to go through some information with you as part of legally accepting this document. It'll take about 2 minutes and I'll send that off to your doctor. Is that okay? Everyone says yes. Everyone wants money back from Medicare, so they're all happy for you to do that. Don't take it home with you. Don't do it on your lunch break. Do it in a session with them and just say, you know, So I've outlined some goals: vocabulary, expressive language, keyword sign, an assessment, and then I just sign it there, and I'll say, I'll just post this to your doctor. So we can post it, fax it, and I think we can Medifax it or like PDF it through technology now, because that one is encrypted. But in the old days, you could only post it or fax it. If the parent is going back to the, I probably just wouldn't give it to them either. So just, it's between you and the doctor. Take a copy for your records, upload it, have it on the system, on the Power Diary system. So that is your evidence. And as long as we've got copies and it's uploaded on a soft copy, fantastic. And then with the physical one, either fax it, post it, whatever we're using at that time. Could be a PDF, e-fax, whatever. So that's pretty much it. And then I take a little note to say after they've used their 5, some people will go back and get another copy, even though I say no, like you can't use one. Yeah, they literally, Medicare just won't give them any more receipts. So don't worry, you can't over receipt them or anything like that. And we just document it in the progress notes. For example, I'll write like EPC 1, 1st of January, 2021. And at the beginning of a new year, I'll always say to parents, just reminding you that you're now eligible to talk with your doctor about getting an EPC again. So, and they've got all year to use it. So I say, take your time. And if you have any questions, let me know.